Today's lesson we are looking at contraceptives, State Standard 6.9, compare various contraceptive methods. Our objectives will be that students will be able to define contraception, that students will be able to identify and discuss contraceptive methods, and they'll be able to identify causes, modes of transportation, treatment, and prevention measures associated with STIs and HIV and AIDS. In this lesson, I'll use the term STD and STI interchangeably, but STI is the more modern and more correct term. We've learned the effects of sex. They will explore the deeper methods, the more effective methods to prevent STIs and unwanted pregnancy. In the abstinence lesson, we learned the most effective method to avoid STIs and unwanted pregnancies through abstinence. We'll explain contraceptives today for a further understanding of other, while less effective methods. So I want you to think, why do we need to learn about the different contraceptives? And what's the best method? And why do so many people use these methods incorrectly? And we'll explore those today and help you decide what is best for you and your value system and your family's value systems. Now, this is an abstinence first program, as we teach abstinence is the only method to ensure no unwanted pregnancies or STIs. Now, full abstinence is no vaginal, anal, or oral sex, and it also includes, if you want to ensure that you do not have any unwanted pregnancy, you cannot have any of the male sperm around the woman's vaginal area, and to ensure no STDs, you cannot even have the areas rubbing against each other, because you can get STIs that way. You cannot get pregnant or a STI if you are abstinent with no genital to genital, skin to genital, or bodily fluid to genital contact. You can get pregnant without having sexual intercourse if sperm is near the opening of the vagina. You can get some STIs by touching the genital area of your partner. The withdrawal method is extremely ineffective. So we'll talk a little bit more about that later. I'm looking at unwanted pregnancies here, and the main thing I want you to realize is where it says perfect use and correct use, or incorrect use. You can see that the numbers are so much higher. Now we look at the male condom. With perfect use, about 20 out of 1,000 women get pregnant. With incorrect or with common use, 150 out of 1,000 women get pregnant. So it's very common to use a condom incorrectly. Very common to use many of these incorrectly, which is why the methods where where a physician does it, it's more effective, and it's simply because of human error. There's several different methods. First, we'll look at the barrier method, which includes a male condom, the female condom, the diaphragm, and the sponge. It provides a barrier for skin-to-skin contact and bodily fluids, which can help protect against pregnancy and STIs. You can get these at pharmacies, grocery stores, and health clinics. A condom can be used for oral, vaginal, and anal sex when sharing sex toys and while sharing sex toys. And most condoms are made out of latex. There are non-latex types. When using these, you need to check the expiration date and keep in dark, cool places. You cannot use with oil-based products such as Vaseline, baby oil, or hand cream, because they increase the chance of the condom breaking. A new condom must be used every time a person has sex, and you can never use 2 condoms at once. Condoms are worn by the man, and a male condom keeps sperm from getting into the woman's body. The latex condoms, which are the most common type, help prevent pregnancy and HIV and other STIs, as do the other newer synthetic condoms. In the past, more what they call natural or lambskin condoms are used. You don't see those very often. And they can help prevent pregnancy, but may not provide protection against STIs, including HIV. Male condoms are about 85 to 90% effective at preventing pregnancy. but 85 to 98%, but unfortunately it's not 100%. Condoms can only be used once, and they're most effective when used consistently and correctly. You can buy condoms with KY jelly or water-based lubricants at drugstores, but do not use oil-based lubricants such as massage oils, baby oil, lotions, petroleum jelly with latex condoms. They will weaken the condom, causing it to tear or break. Oh, that says male condom right there, but it is a picture of a female condom. I have a incorrect picture there. That's the male condom pictures. We're moving on to female condoms. Female condoms provide a barrier for skin-to-skin contact with bodily fluids, which can help protect against pregnancy and STIs. Again, available at pharmacies, grocery stores, and health clinics. They must be inserted prior to any vaginal contact, and they can be inserted up to 8 hours prior to intercourse. So the benefit there is if a lady knows she's going to have sex that evening, then she can put it in before the date even begins, so she doesn't have to fool with it later on. Their soft, thin plastic quickly warms the body temperature, which allows for natural feeling and sensitivity. They're safe to use for people with latex allergies. And you can use water and or oil-based lubricants, but they cannot be used along with a male condom because that will increase the chance that both will break. And they will need to be they cannot be reused, so you need to throw them away after use. Benefits are they're widely available, and they do provide some protection against some STDs, and they conduct body heat better than a male condom. The cons are they can be noisy, and up to 21% of users get pregnant, mainly due, many of those, not all of them, but many of them due to incorrect use. They're not reusable, and they should not be used with male condom because the extra friction. To help you visualize what these look like and how they work. Now the diaphragm with spermicide is a round rubber and rigid rim. Is round and is made out of flexible rubber with a rigid rim that covers the cervix. It is placed inside the vagina to cover the cervix to block sperm. The diaphragm is shaped like a shallow cup, and you can insert it just prior to intercourse, or even up to 6 hours beforehand. Again, you don't have to do it at the last minute. Women should use spermicides with this barrier method as it will help kill the sperm and prevent fertilization. It is 84 to 94% effective at preventing pregnancy. Now, a physician must fit these because diaphragms come in different sizes, because the woman's cervix comes in different sizes. They're inexpensive, as they're about $15 to $75 per device that lasts 2 years. Cons are they must be fitted by a physician, and they have no STD protection. They can't be used during your first period. They cannot be used during your period due to a risk of toxic shock syndrome. So they cannot use during the period. Now the cervical cap, this is similar to the diaphragm, but smaller in size. It is used in the same fashion as the diaphragm, as it fits over the cervix and keeps sperm from entering. The cap should be used with spermicide for extra protection, can be inserted in intercourse, and can be left in for up to 24 hours without spermicide. It should be washed, dried, and stored in its case after each use. And also you should visit your doctor for a proper fitting because cervical caps come in different sizes. It can stay in place for about 24 hours, so that's an advantage. Now the disadvantages are they must be fitted by a physician, and they do not provide protection from STDs, and they cannot be used during the period. A name brand on this is the Fem cap. Failure rate for the cervical cap is about 15% for women who have never had children and 30% for those who have. Another diagram to help you visualize how these work. The sponge is made of plastic foam and contains spermicide. It is soft, round, and about 2 inches in diameter. It is a nylon loop attached to the bottom for removal. The sponge is inserted into the vagina to cover the cervix and block sperm's entry. The sponge is more effective for women who have never given birth, and therefore there are varying levels of effectiveness. The advantages are no prescription is needed and is effective immediately. The cons are is difficult to insert correctly, and they do not provide STD protection, and they cannot be used during your period. Another diagram to help you visualize how these work. Now the hormonal methods, there's several types. With perfect use, hormonal birth control is 90% effective at birth control, but not at all protective for STIs and STDs. With typical use is 92 to 97% effective against unwanted pregnancy. It makes your period more regular with less bleeding and less pain. Can even protect you against some types of ovarian and uterine cancers. Again, it does not protect. Hormonal methods do not protect from sexually transmitted diseases. Now, our side effects. Side effects, these include the hormonal methods, the pill, the monthly pill, which is fairly common, the patch and the vaginal ring. Side effects are irregular bleeding, spotting, nausea, mood swings, bloating, breast tenderness, and headaches. Most of these symptoms will stop after about 2 or 3 months. Looking at birth control pills, and the pill contains hormones that keep the body from releasing an egg. If used correctly, it is 90% effective in preventing pregnancy, although there are no STI protections. The pill must be taken at the same time every day. And now some females take the pill to regulate their menstruation, their periods, to reduce cramps and decrease acne. So you cannot assume because you see birth control pill in a lady's bathroom that they are necessarily sexually active. It's about $16 for a month's supply. You do need a doctor's prescription. The advantages are you'll have more regular periods, lighter periods, or possibly even no periods, depending on the type of pill. Can have less cramping. The disadvantages are there's no STD protection, and it can have those side effects, which I mentioned earlier: breast tenderness, spotting, serious blood clots, raised blood pressure, and some women cannot take them. The physician will let them know if they cannot. Now, they're taken all month, all cycle, and there's certain days you can't take them, and those days that you have the 7-day hormone break, you'll actually take it's a different color pill there, they're sugar pills, just to make sure you're in the habit of taking it at the same time every day. Now, if you don't take your pill at the same time every day, or if you forget pills, they do not become effective. So you have to make sure they're always taken at the exact every day and regularly. So if you're the kind of person that might forget to take a pill, these might not be for you. The patch works very much like the pill. It's about 98 to 99% effective. You wear 1 patch a week, and then you change it every 3 weeks. Or you change it every week for 3 weeks. The 4th week, you wear no patch while you get your period. It's good for people who forget to take a pill every day. That's the main advantage here. It's about $17 a month with a prescription. So women who have trouble remembering a daily pill may want to consider the birth control patch. Name brand is the Ortho Evra patch. It's worn on the skin and changed only once a week for 3 weeks, with a 4th week that is patch-free. The patch releases the same types of hormones as birth control pills and is just as effective. You have all the same pros: more regular, lighter periods with less cramping, no need to remember a daily pill. The cons are the cost, and it may cause skin irritation or other side effects similar to birth control pills, and it does not protect against STDs. The vaginal ring works like a pill and a patch. It's 98 to 99% effective. The woman inserts the ring inside the vagina for 3 weeks and then removes it for 7 days while menstruating. It's good for people who forget to take the pill every day. It's about $24 a month with a prescription, so you do have to go see a physician and get these. Advantages are, again, there's lighter, more regular periods. Cons are they're about $30 a month, kind of depends. And they can cause vaginal irritation or other side effects similar to those as the pills in the patch. They do not protect against STDs. There's another image to help you visualize it. Again, another image. Now the shot, Depo-Provera is the name brand, it inhibits the release of an egg and is 99.7% effective at preventing unwanted pregnancies. There's no STI protection. Women will receive an injection or a shot every 3 months in your arm or your hip. It's good for people who forget to take the pill every day. Most will stop having periods after about 6 months to a year of use. While on Depo-Provera, the strength of your bones can be reduced, and this is proven to reverse after you come off this method. While you take it, you need to make sure there's enough calcium and vitamin D in your diet to keep your bones strong. Now, if there's a chance you might want to become pregnant quickly, this might not be the best method, because it can take 1 to 2 years after these shots to get pregnant. A 3-month supply is about $36. Pros are it's only injected 4 times a year and is highly effective. The costs are it can be about $240 a year. The price ranges vary depending on what I found online. It may cause spotting and other side effects, and it does not protect against STDs. Image of a woman getting the shot. Now, spermicides work to kill sperm before they reach the egg. When used with a condom, they are 97% effective, but you cannot use this method alone. You only use this method with a condom. Foam needs to be inserted in the vagina about half an hour prior to intercourse. A gel called Advantage 24 can be inserted up to 24 hours in advance. But you still need a condom. You do not need a prescription, and you can buy it at a drugstore or over the counter. So no doctors needed. They're about $13 to $22 at the pharmacy. They're easy to use, inexpensive, about $1 per use. The cons are they may increase the risk of STDs, and about 29% get pregnant. And some more images to help you visualize what they look like. And there's other methods, the IUD and natural family planning, sterilization, withdrawal methods. The IUD is a T-shaped device which is inserted into the vagina by a health professional, and it stays in place. It's about 99.8% effective, and it lasts up to 10 years. Some of the side effects are heavier, tougher periods, and side effects similar to the pill if the device contains hormones. Some contain hormones, some don't. The benefits are longevity, and there's no planning needed before sexual intercourse. So you don't have to plan ahead and think, what do I have enough of whatever I had planned on using? When am I going to insert it? This lasts up to 10 years. Now, actually what I've read is sometimes some of them last up to 10 years, some of them 3 to 5 years. So there's I guess different brands, and different brands last different varied amounts. So you need to find out based on what you're using, and when the woman goes to their a gynecologist, they will discuss this and tell them what the physician recommends. Now, these have copper, which affects how the sperm move and help prevent embryo implantation. It needs to be inserted by a trained health professional. The advantages are they're long-lasting and low maintenance. The disadvantages are the irregular and heavy periods. They can be more expensive up front, but not necessarily in the long run, and they may slip out and may cause side effects. Oh, you can't see my sign very well at the bottom. I thought I had that looking so good. Now, the natural family planning is more effective at helping a couple get pregnant rather than avoiding pregnancy. Matter of fact, it's not a very effective method in avoiding pregnancy as the other ones we've talked about, but it's pretty effective in helping a couple get pregnant. The advantages are no drugs or devices. it's inexpensive, as in it is free. And the cons are it limits spontaneous sex. And 25% of typical users get pregnant using this method. So 25% fail rating is not very good. You'll need to understand your monthly fertility pattern to help you plan to get pregnant and avoid getting pregnant. Your fertility pattern is the number of days in a month when you are fertile, able to get pregnant, if you have a regular menstrual cycle. What happens is a woman tracks the menstrual cycle, uses a calendar, and takes their temperature at the same time every day. And they can use the temperature to find out when they are more fertile and less fertile, and they'll track it based on when they're menstruating, and they can use the temperature to tell kind of where in their cycle they are. Now, a woman can get pregnant at any time during the cycle. Now, although some days they are more fertile than others. So some days is more unlikely, while other days is more likely. Female sterilization, or tying the tubes. A woman can have her fallopian tubes tied or closed so that sperm and eggs cannot meet for fertilization. This procedure can be done in a hospital or in an outpatient surgical center. You go home the same day as the surgery and resume your normal activities in a few days. And this method is effective immediately. In the female sterilization, a thin tube is used to tie a thread is used to thread a tiny device in each fallopian tube, and it irritates the fallopian tubes and causes scar tissue to grow and permanently plug the tubes. It can take about 3 months for the scar tissue to grow, so they can use another form of birth control during this time. And they can even check, a physician can even check to see if the scar tissue has fully blocked the fallopian tubes. Now, the male sterilization of vasectomy, and I have an image of that on the screen. This operation is done to keep a male's sperm from going to his penis, so his ejaculate never has any sperm in it that can fertilize an egg. So the men will still ejaculate, it just will not contain sperm. Because remember, the ejaculate comes from several different places, as we learned in our anatomy lesson. This operation is simpler than tying the woman's tubes, and the procedure is done at an outpatient surgical center. The man can go home the same day, and the recovery time is less than 1 week. After the operation, a man visits his doctor for tests to count his sperm and make sure his sperm count has dropped to 0. This takes about 12 weeks. Now, another form of birth control should be used until this man's sperm count has dropped to 0. The pros of these two methods are they're permanent and cheaper. This method is permanent and it's cheaper than the woman's tubal ligation, and it's about 100% effective. The cons are it requires surgery, and it is not effective immediately. You have to wait several weeks, and it may not be reversible. So you can have surgery to reverse this, but that surgery may not be effective. Now, the withdrawal method is when the man and the woman have unprotected sex, and the man, before ejaculating, withdraws from the vagina. Now, the pros are it's free and no use for devices. The cons are it may be hard to do so correctly and no STD protection. Additionally, American studies have found that 15 to 28% ineffective, because the man ejaculates and they can feel the ejaculate. Before the ejaculation, they have what's called pre-ejaculate. There's also other names for that. And in the pre-ejaculate, can contain sperm. That is debatable, but even the Mayo Clinic, which is pretty much the most respected healthcare in the United States, claims that the pre-ejaculate does contain sperm, and therefore the pre-ejaculate, which the man cannot feel, does contain sperm and can get a woman pregnant. Another disadvantage is both the man and the woman can get very frustrated by having to keep interrupting things at the last moment. Again, with this lesson, our goal is to help you make educated choices that you will not regret. The only safe sex is abstinence, but if you choose to be sexually active, you'll be more informed. For additional information, additional help, the textbook has more information. But if you need to talk to somebody, a school counselor, a teacher, if you would prefer to email, I'm happy to email you. You email me your question, I'll be happy to answer. School nurse, walk-in doctor, family physician. If you have any questions, again, feel free to ask in class, email me, or talk to me directly.